So this is a video over medicine for intro to CPT. If you turn and open your textbooks, you can pause me and get to the right spot if you're not already. Open up to the medicine chapter. And the very first page, there's a little bit of an introduction I want to read and then talking about the format. The medicine section reports diagnostic and therapeutic services that are generally non-invasive, and in parentheses we can see there it means not entering a body cavity. But there are also invasive procedures in this section. So generally there isn't, but there is a few, just when you think you got it figured out, right? Cardiac catheterization is here. Don't worry about that. It seems pretty intense. It is. We will work on that in the advanced CPT class. The section begins with subsection information and guidelines. Of course, those green pages at the beginning of every section, right? Make sure you go through those. The format, it says, let's take a moment to go through. Many specialized types of tests are located in this medicine section. Codes in this section do not usually include the supplies used in the testing, therapy, or diagnostic treatments unless specifically stated in the code description or the guidelines. Report supplies, including drugs, separately unless otherwise instructed in the code information. CPT code 99070 is a supplies and materials code to identify any type of the supplying of the drugs, surgical trays, supplies, or other materials needed to provide these services. If you look at Introduction to Immunizations, we really take some time here in this area. This is just the introduction to it, and then we'll look at each type specifically separately. There are two types. We have active and passive immunization, okay? Active immunization is the type given when it's anticipated that that person will be in contact with the disease. Active immunization agents can be toxoids or vaccines. Toxoids are bacteria that have been made non-toxic, and when we inject them into us, they make our body produce an immune response, and it builds up protection against that type of disease, whatever that disease is. Vaccines are viruses, vaccines are viruses. They're given in very small doses. They cause also our body to produce an immune response and build up those antibodies. Passive immunization does not cause an immune response. Rather, we're simply injecting material that already is your antibodies into your system against that disease. So in the first active immunization, toxoids or vaccines, we force our body to create an immune response and build up antibodies against that specific disease. In passive immunization, we are actually giving the antibodies. Our body doesn't have to produce them. We are injecting them. Okay? So I have little notes on the side there just to kind of help you keep that straight. A toxoid, it's bacteria. It produces that immune response. Vaccines are viruses, but in very small doses. Passive is straight antibodies. Okay? Immune globulins are talked about at the very bottom of the page. If you turn, we have immunization administrations, okay, for vaccines and toxoids. And they kind of put these in the middle because if you see over on the next page now, we have vaccines and toxoids. But they stop in the middle. I don't know why. They break and they say, okay, administration. I'm going to read the first paragraph here and then we'll talk a little bit. The immunization administration codes, and it says 90460 to 90474, are reported in conjunction, so at the same time, as the vaccines, toxoids, subsection codes. Immunization reporting requires two codes, one to report your administration and one to report the substance administered. A variety of administration methods are used to deliver. We can do percutaneous, intradermal, sub-Q, IM, intranasal, like the flu mist, or oral. The administration codes are divided based on the method of administration, and in some codes by patient age, or if it's administered with counseling at the same time. So report each dose administered, single or combination, with the appropriate administration code. So I have a little note here on the side that says we need to note, is there counseling, yes or no? Usually there isn't. I think the only time, and I coded this for 12 years, outpatient. We do a lot of vaccinations and immunizations in the clinic. And the only time I ever really used with counseling, okay, they're totally separate codes, with counseling, is when the HPV vaccine came out. It was different. It was new. It was kind of edgy. First, it was just for girls. Then it was for girls and boys. There was a lot that came out with this. And counseling had to be done at that time by the provider. Now, I have to say by the provider, okay, with your qualified health professional or your MD. It can't be by the nurse, okay? And this is more than just the nurse or the doctor printing you the CDC paper on the vaccine, which is what they usually do, and say, here you go. You can take it and read it whenever you want. That's not counseling, okay? This is actual face-to-face. We're in the room or the office together, and we're talking about this, okay? So counseling very much has to be documented very specifically. If it is documented, then of course we can bill for it. But I do have a note, and I do want to say usually counseling isn't the case. We have a strict regimen of what vaccinations have to be done for us and for our kids, and everyone knows about it, and they're not new, and it's very much a known situation, and we don't do any counseling for that, okay? So if you look at the green example here, I do want to say that it is okay, but the order is kind of goofy. You see that they have listed the administrations, and then they list the substance, and then they do an administration, and then they list the substance. It's very much practice, always has been in all the facilities that I know, that we report the substance first, and then the administration of it, and then the substance first, and then the administration of it. Okay, so you have to make sure, I think we identified the substance first, and then we, put the admin on there. So I understand what the book is trying to do, but I don't agree with the way that they do it. That order is kind of goofy there. If you look at the next page, there is a couple of CMS rules here that are good for us to read, and a little bit, I think it might be a little over our heads yet till we get to reimbursement class. We do hone in on this in reimbursement, but they are good to note here, and the book definitely does a good job of solidifying some issues that rules and regulations that Medicare has or CMS has for Medicare and Medicaid services. The first CMS rules kind of note up there says Medicare reimburses for tetanus injections when given for an acute injury to a person who is incompletely immunized. So it's time, they need it, they're not covered, they have to have it. When a tetanus booster is given to a patient in absence of injury, the injection is not covered by Medicare. So Medicare has rules and regulations that we need to follow. We can't just pick a code out of the book and let it go, okay? And we get into a little bit that as our program advances. But it is important to know we need nursing support, okay? The documentation, we work very closely with our nursing staff. Did the patient step on a rusty nail? And had to come in, and their tetanus had been 12 years, and so they needed one. Okay, perfect. That's covered. There's an injury there. But was the patient in for a sinus infection or a regular annual physical, prevent med type service, and we saw that their tetanus was 12 years old and we should update that? That's not covered. Okay, so we have to be careful with kind of what's going on. If we just notice and there is no injury, we have to be cautious with what kind of a patient we're dealing with and what kind of coverage that they have, because Medicare does have a lot of rules and regulations that we need to follow to participate with them. Vaccines and toxoids are talked about next. I guess some of the main points of that paragraph, and you can read through that on your own as well, is You know, we have codes that have a single disease or single disease type codes with single substance, or we have combination type codes that have a few different substances in there for a few different types of diseases. It says in many of the code descriptions, specific ages or dosages are identified, so we have to pay attention to those too. There's a lot of little things here with these to make sure that we get straight. For example, in 90658, trivalent, and that means it covers 3 different viruses or strains of the influenza virus vaccine. It specifies 0.5 mils, whereas 90657, influenza vaccine trivalent, specifies 0.25 mils. Vaccines have an adult, pediatric/adolescent, or dosage amounts listed on the label of the vial. You have to carefully review the description of your vaccine product to determine what code, you need to assign here. So you have to be really, again, more communication with your nursing staff. Those are who orders those and knows what we have on hand and what we're giving out. There isn't one code for influenza vaccine, a flu shot, and I think you'll see that when you get into the CPT book. The other CMS rules shot here talks about our G codes for Medicare, which are really fun. When reporting an adult dose of the pneumococcal vaccine 90732 to Medicare, we use a G code for administration, G0009. Medicare has some codes, and they start with G, and they want us to use them for their, patients, for our Medicare patients. So it talks about it a little bit. Again, we go over these more in advanced CPT and then in reimbursement class as well. If you turn to the next page, look at the coding shot there. It talks a little bit. These are good paragraphs to go through. I just don't need to do it with you. The coding shot there says if the only service is the administration of a vaccine and no other service was provided that day, do not report an E&M service. Okay? And I have a little note here next to that says you can look at the schedule. What was the patient scheduled for? Did we talk about the HPV with my 11-year-old daughter last week when she was here, and we decided we would, come back in if we wanted it? And so now we're back in, and we've already talked about it. It's already been documented on a previous visit, correct, in a previous document. We just want to come and have it. There shouldn't be any office visit that day, okay? But do pay attention to that 99211. Remember, we wrote nurse only next to that code. That might be something that would get billed out that day, okay? The green box there in that page goes over, and you can see some of the G codes there, these Medicare codes for administration for a regular self-pay or commercial payer, third-party payer, Continental General or Blue Cross and Blue Shield or Wellmark. 90658 is your influenza code, and 90471 would be the administration of that. But for a Medicare patient, 90658 would be given, okay, for the substance, but the administration for Medicare is G0008. Okay, again, this is Medicare only. After this page, I want you to turn all the way to the back of your chapter, and actually for 2019 it says page 657. So turn to page 657 and we'll finish the last section of the medicine. Again, yes, we have things that we're skipping, but we picked them back up in advanced. OMTs and CMTs. I want to talk about this quick and then we'll be done. OMTs, or osteopathic manipulative treatment, if you see at the bottom, I want you to read through this and make sure you understand the differences between those. And really the difference is, who is the person that is doing this to me or doing this to our patient? An OMT is a doctor of osteopathy or a DO. Okay? Very, very common. DOs can crack our back or give us, adjustments or treatments. They can deliver babies. I mean, they can do anything, okay? But DOs, okay, if they have that, if they're not an MD, they're a DO, they can perform OMTs. And so I want you to read about that. CMTs are on the next page. That's chiropractic manipulative treatment. Again, so that would be a chiropractor who is giving that to us. Okay. So again, those codes are different. You need to be really careful in the CPT book that you understand the regions. Okay. I worked for a provider once that said that if he cracked the patient's back, he was a DO. And if he went and gave them an OMT, a treatment in the back room, and he cracked the patient